Okay, ready to dive into something we all experience but rarely talk about.
Pain.
Pain. It's intensely personal, but also, universal, right?
Mm.
We're going deep with the excerpts you shared from Melanie Thernstrom's The Pain Chronicles.
Ah, yes, chapters 3 and 4.
Exactly. We're going to trace how our understanding of pain has evolved over time. It's fascinating stuff.
It is fascinating, isn't it? Pain has been a constant throughout human history, but the way we've thought about it, treated it, it's shifted
And
dramatically.
there's so much we still don't get.
Absolutely.
Okay, so think of this as a journey through pain's history. But what does history tell us about our experiences with pain today? That's what we're really getting at.
Exactly. The past illuminates the present.
It's wild to think about surgery before anesthesia was a thing. I mean, it wasn't common until the late 1800s, almost a century after they knew it could work.
Yeah, it makes you wonder why. And it wasn't just about the technology, the science of it. There was a deep resistance to the whole idea of anesthesia.
Really? Why? I mean, wouldn't everyone want less pain? Especially during surgery?
Well, you'd think so, right?
Hmm.
But surprisingly, surgeons were some of the biggest opponents to anesthesia.
Surgeons.
Surgeons.
Really? Why would they resist something that could ease their patient's suffering? I don't get it.
It's a different mindset back then. See, surgery was almost like this heroic act and pain, suffering, that was seen as an integral part of the heroism.
Pain was part of heroism.
Yeah, like it was a testament to the surgeon's strength, their ability to endure alongside the patient.
But what about the patient's perspective? What about their pain?
It wasn't really considered the patient was passive, just receiving care. Their experience was secondary to the surgical process itself.
Wow.
And then you had all these social anxieties about anesthesia. People comparing it to drunkenness, fearing it would be abused, used for bad things.
That's so interesting. It's almost like they were more worried about the loss of control than the pain itself. Like they were afraid of what might happen if you weren't in control.
There was this fear that it could be used to harm people, especially women. Fears of assault and things like that. It all reflects this societal anxiety about the unknown, about messing with consciousness.
It is pretty profound when you think about it, right? Like tampering with something as fundamental as consciousness.
Absolutely.
Thernstrom talks about Queen Victoria using chloroform during childbirth as a turning point.
Yeah, that's a key moment.
If the Queen could do it, it must be okay, right? That's how people must have seen it.
It definitely made it more socially acceptable, but it also reflects a deeper shift, don't you think?
How so?
Well, did it pave the way for the medicalization of childbirth? Shifting control from women to physicians? It's something to think about.
That's a great point. It seems like the history of pain isn't just about science, it's about power and control too.
Absolutely.
Which brings us to how our thinking about pain itself has evolved. For ages, pain was just a symptom, right? A sign of some underlying disease. Find the disease, treat it, pain goes away.
Right. If only it were that simple. We know now that chronic pain can outlast its original cause. It can become a disease in its own right.
Chronic pain as a disease. That's a big shift in thinking.
It is, and it's a huge problem. 1 in 5 Americans suffers from chronic pain, but we have so few pain specialists. It's a silent epidemic, really.
1 in 5. Wow, that's staggering. So why the disconnect then? Why are so many people suffering with chronic pain if we know it's a disease? Why isn't there more treatment available?
Well, part of it is the difficulty of diagnosing chronic pain. It's not like a broken bone that you can see on an x-ray. It's often elusive, hard to pinpoint the root cause.
Yeah, I can see that.
And unfortunately, when patients describe their pain, it's often dismissed, brushed aside.
Thernstrom talks about this, right? How people suffer for years and their pain is just seen as all in their head or exaggerated, like their experience isn't valid.
Exactly. And a lot of doctors just don't feel equipped to handle chronic pain. It's complex, it's multifaceted, and the traditional treatments don't always work.
Okay, let's talk about this neuropathic pain revolution then. What is neuropathic pain and how has it changed our understanding of treatment?
So neuropathic pain, it comes from damage or dysfunction in the nervous system itself.
So the problem is in the nerves.
Yeah, think of it like faulty wiring in your body's electrical system. The signals get crossed, amplified, and you feel pain even when there's no tissue damage.
That's wild. So like a phantom limb, but with pain?
It can be like that, yeah. Thernstrom has that story about Lee Burke, remember?
Yeah, the woman with the debilitating headaches after brain tumor surgery.
Right. Initially, they thought it was muscle tension. Turns out it was nerve damage from the surgery. Took years to get the right diagnosis.
Cases like that really highlight why it's so important to understand the different types of pain. Like, what we might think is muscular or skeletal could actually be neuropathic, right?
Absolutely.
Ah.
And that changes everything in terms of treatment.
Because you can't fix bad wiring with painkillers that target muscles or inflammation.
Exactly. That's the revolution in thinking.
So this understanding of neuropathic pain is a game changer. But it seems like we're still in the early stages of figuring out how to diagnose and treat it effectively.
We are. It's a new frontier, really. And it gets even more complex when you bring in social and cultural factors. How gender, race, even something as seemingly superficial as hair color can all impact a person's experience of pain and how they're treated.
Okay, so now we're getting into disparities in pain treatment. How someone's identity can actually affect the care they receive for something as fundamental as pain.
We're going to unpack that in the next part of our deep dive, but it's a critical issue.
It is.
For now, just consider this. If pain is subjective and influenced by so many things beyond the physical, how do we ensure everyone gets the care they need? That's the question.
And it's a big one. You were saying how social and cultural factors can actually influence the kind of pain treatment someone receives.
Yeah, it's troubling, isn't it?
It really is. It's unsettling. Where do we even start unpacking that?
Well, Thernstrom points out some pretty shocking disparities, especially around gender and race. It all goes back to these biases, expectations.
And just systemic issues in healthcare.
Absolutely.
Like she mentions women being more likely to get prescribed psychotropic drugs for pain, while men are more often offered opioids or surgery.
It's like there's this assumption that women's pain isn't real.
Or that it's all in their heads.
Exactly. It's more psychological, less deserving of serious treatment. That's the message it sends.
Thunstrom talks about a study in Norway.
Oh, yeah, the one where women with chronic pain felt like they had to downplay it?
Yes. Like they had to present it in this very specific way just to be taken seriously.
It's awful. It's like they're facing this extra burden of proof that men just don't have to deal with.
And then on top of that, you have racial bias, which is even more alarming when you think about the consequences.
Absolutely. Black patients are consistently undertreated for pain. Less likely to get opioids, more likely to be seen as drug-seeking.
Even when their pain is just as real, their medical histories are similar. Everything.
It's a huge problem. And it goes back to these harmful stereotypes about Black people and pain sensitivity. Like that myth that they're somehow less sensitive to pain.
Which is total nonsense, right?
Total nonsense. In fact, studies actually show the opposite. African Americans are more likely to experience chronic pain and might even have lower pain tolerance.
So not only are they more likely to suffer from chronic pain,
But they're also less likely to get the treatment they need. It's a double injustice.
this all circles back to opioids, which are a tricky subject for obvious reasons. There's a lot of fear surrounding them, and for good reason, but
It's a tightrope walk, isn't it?
it is. Doctors want to help their patients, but they're also worried about addiction, legal repercussions, all of that.
It's a real dilemma. I think it's important to remember that the risk of addiction from opioids is often blown out of proportion, especially for patients who don't have a history of substance abuse.
Right. And Thernstrom talks about pseudo-addiction.
Yeah, that's when patients might seem like they're drug-seeking, but they're actually just not getting enough pain relief. It's not true addiction.
They're desperate.
They're desperate for relief. It's heartbreaking. She talks about Dr. McKiver, the pain specialist, who was sentenced to 30 years for drug trafficking.
That case is wild. His defenders were saying he was just trying to help his patients.
But he got caught up in the whole crackdown on opioids.
There was that story about one of his patients, the farmer, that really stuck with me.
Oh, yeah, the one who had terrible back pain.
Yes. Dr. McKiver was able to manage his pain with opioids, but after the arrest, his new doctor cut back his dosage way too much, and his pain came roaring back.
He could barely function, couldn't sleep, had to give up farming.
Which was his livelihood. It just shows the very real consequences these policies can have. We have to address the opioid crisis, yes, but we can't forget about the people who genuinely need these medications.
Exactly. We need a more balanced approach. One that acknowledges the risks, but also recognizes the suffering and the potential benefits of opioids when they're used responsibly.
So education, clear guidelines, better support systems.
Exactly. We need to find ways to help people manage pain without resorting to opioids whenever possible.
Okay, you mentioned some of Dr. Wolf's research earlier. Some of it was a little over my head, to be honest, like the stuff about central sensitization and all that.
Yeah, that could be tricky to wrap your head around.
Yeah.
But basically what he's showing is that chronic pain doesn't just stay at the site of injury, It actually changes the brain and spinal cord,
Rewires them.
rewires them, makes them hypersensitive to pain signals, like an alarm system that's always going off, even when there's no danger.
Wow. So even if the injury heals,
The pain pathways are still stuck in overdrive.
and that can lead to actual physical changes in the brain.
It can. It's almost like premature aging in the brain.
That's both fascinating and terrifying. No wonder chronic pain is so hard to treat.
Exactly. It's not just about fixing the initial injury. It's about dealing with these deeper changes in the nervous system.
That makes sense.
But the good news is that this research is opening up new avenues for treatment. Dr. Wolf is working on a pain-specific anesthetic that could be a game changer for certain procedures.
That would be incredible, like surgery without all the side effects of traditional anesthesia.
Exactly. And there's a lot of interest in things like gene therapy, targeting specific pain pathways, and non-invasive stuff like virtual reality is showing promise too. It's an exciting time to be in this field.
There's hope for the future then. That's good to hear. But in the meantime, there are still so many people struggling with chronic pain. And it's clear that it's not just a physical experience, it's emotional, psychological. It affects every aspect of your life.
It does. Thernstrom talks about this pain specialist who was really moved by one of his patients, a train conductor who had lost 3 limbs.
Oh, yeah, I remember that story.
Despite everything, this guy was incredibly resilient. He found solace in stories of other people's suffering. It's a powerful reminder that our mindset, our coping mechanisms, can make a huge difference in how we experience pain.
It's not just about the physical sensation, it's about the meaning we give it, right?
Exactly. And that's where the idea of integrative versus disintegrative pain comes in.
Can you explain that?
So integrative pain, it's pain that we can make sense of, that we could incorporate into our lives without letting it define us. Like the pain of childbirth or intense athletic training.
Huh.
It's challenging, yes, but it can also be empowering.
Right. You push through it, you grow from it.
Exactly. Disintegrative pain, on the other hand, it overwhelms you, it breaks you down, it can lead to despair, isolation. This is often the case with chronic pain, which can feel relentless and unpredictable, like your own body has betrayed you.
So the question is, how do we help people shift from that disintegrative experience to a more integrative one? How do we give them the tools to cope, to find meaning in their suffering? So we've talked about the science of pain, how our understanding of it has evolved, and all the social and cultural factors that come into play. But where does all that leave us? I mean, what are we supposed to do with this information?
That's the question, isn't it? And it's a tough one. There's no magic bullet, no one-size-fits-all solution.
Right.
But if I had to boil it down, I think one of the biggest takeaways is this. We can't keep thinking of pain as just a physical thing.
Like it's just a broken bone or a pulled muscle.
Exactly. It's so much more than that. It's intertwined with our psychology, our emotions, our culture, our past experiences, everything.
So it's not enough to just treat the physical symptoms?
You have to treat the whole person, their mind, their spirit, their social context, everything.
Thernstrom keeps coming back to this idea that pain has a narrative, a story.
Yeah, I love that idea. It's not just a sensation. It's an experience that unfolds over time that's shaped by so many different forces.
And sometimes that story can actually become a self-fulfilling prophecy, right? She talks about catastrophizing.
Oh, absolutely. When people get caught up in fear and worry about their pain, those negative expectations can actually make the pain worse.
So it's like the more you focus on it, the more intense it becomes.
Exactly. It's a vicious cycle. But here's the thing. If our thoughts can make pain worse, they can also make it better. That's the flip side.
Okay, so how do we harness that power? How do we change the story?
Well, that's where things like mindfulness and cognitive behavioral therapy come in.
CBT.
Yeah, CBT. These approaches can give people the tools to challenge those negative thoughts and develop healthier coping strategies.
So mindfulness is about becoming more aware of your thoughts and sensations without judgment.
Exactly. And CBT helps you actually change those unhelpful thought patterns.
It's about taking back some control.
Absolutely. You're not just a victim of your pain. You have the power to influence how you experience it.
There's that story Thernstrom tells about the study with infants who were circumcised without anesthesia.
Oh, yeah. That one always gets to me. It's so heartbreaking.
I know. It just shows that even babies experience pain, and we have to take that seriously.
And the long-term implications are huge, right? Those early experiences can actually change the developing nervous system, making people more sensitive to pain later in life.
So it's not just about minimizing suffering in the moment, it's about preventing chronic pain down the road.
Exactly. Prevention and early intervention are key.
Okay, so we've covered a lot of ground here. We've explored the history, the science, the social factors, the personal stories. But what's the bottom line? What do we want listeners to walk away with?
I think the most important message is this. Pain is complex. It's deeply personal, and it deserves to be treated with compassion and understanding.
You can't just dismiss people's pain or try to fit everyone into the same box.
Exactly. And we need to be advocating for more equitable pain management practices. Everyone deserves access to quality care, no matter who they are or what their background is.
It's about recognizing the humanity in everyone's experience of pain.
Exactly.
Yeah.
And ultimately, I think it's about empowering people to take an active role in their own healing.
To become informed, to find the right healthcare providers, to explore different treatment options.
To become their own best advocate. And Thernstrom reminds us that there's always more to learn, more to discover. This is an ongoing journey.
And we hope this deep dive has given listeners some new insights, some food for thought, and maybe even some hope. Because while pain can be a source of incredible suffering, it can also be an opportunity for growth and resilience.
It can even be transformative.
So let's keep learning, keep sharing our stories, and keep supporting each other on this journey.
Absolutely.
Thanks for taking this deep dive with us.